We are in Barcelona at a conference where the report about the regional development here was presented, but we were in a panel where we discussed how Finland, Denmark, the UK and Sweden are approaching data, preparing for EHDS and going through the digital transformation. You're from Denmark, you're leading the patient portal in Denmark, which has been there since 2002. How did you already have a patient portal in 2002? It seems so early based on what we see when other countries in Europe had that.
First thing, I think that we had a lot of digital maturity in Denmark. We have already had home banking, net banking, in 10 or 15 years before we had it in the public sector. And then in the early phases, the Danish society also made portals for citizens in general. They made portal for business, and they made, for instance, the same digital entrance code, so you could use the same identifier when you should do something on the internet. It could be for the private sector, for banking, it could be for insurance, or it could be for the healthcare or for libraries. So we had a lot of tools and a lot of building blocks which was made by society 20 years ago.
Long history, that also usually means challenges with legacy systems. Today, when we are not just using IT systems for data entry, but we're also trying to use them for secondary use, for data sharing, how did Denmark address that issue?
About legacy, I fully agree. I think we have our biggest budget ever at Sundhed in these years, and nearly half the budget is about legacy. So actually we are rebuilding the platform, the portals, the apps, so it could be modern, so it could be safe, so we could resist cybersecurity, cyber hacking and so on. So we are actually reinvesting a lot of resources, and it's one-to-one. We are reshaping the portal and the platform as it was before. But at the same time, and also part of your question, in the next phase, I'm sure we will use more secondary data on the platform. I think it's very good because it's online. You have your real-time healthcare data as a patient or as a healthcare professionals. It's also very important to mention the healthcare professionals because it means that they have the same data wherever they are in the country, and whatever situation they are, they can always look up a patient. Very important. But next step will be, I'm sure, to have more secondary data. And I'm also very secure that it will happen because due to a healthcare reform going on in Denmark in these years, we're also reorganizing digital health. So we are going together with Medcom, who is making the standards. Sundhed is going together with Medcom, and the National Board of Health Data is also going within that organization. It calls Digital Health Denmark. And Digital Health Denmark have incorporated all the secondary data, genome data, a lot of data. So I'll just look so much forward to use those also back to the patients.
The reform was started at the end of 2024. By January 1st, 2027, the Digital Health Denmark entity is going to be established, which is going to kind of centralize all the different actors that have been dealing with healthcare data and healthcare IT infrastructure so far. How was that met in the professional circles from IT providers? Was it met with any resistance to do this type of centralization? Can you talk about the broader context on how you came to this decision in Denmark?
It's a political decision. It's a democracy political decision, no doubt. And if you follow the politicians who have been behind this through the years, you can truly see this is how it was meant to be. So we have to respect it. And as a CIO, I have been used to have a political board, so no problem. It's a political decision. Also, one of the reasons is that people want a more clear governance. because there have been so many different steering committees, so many different boards. It has been working, but I think it can be more smooth when it comes to governance in the future. And what is also important is to mention, you're talking about a centralization. I truly understand why you're talking about that. But actually, the organization is also spread out. So one location is in Copenhagen, another location is in Odense. I already have some of my people in Copenhagen and some in Odense, but also there will be people in the northern part of Jutland. So geography is very, very spread out. And saying the word centralization, it's also one of the purposes that it should not be a new national board of digital health. It should be a self-governing public institution.
How are patients going to feel the change, and when? We mentioned that the digital health entity, the Digital Health Denmark, starts operating next year. It's already a year since the reform was put into place.
And actually we are at the moment in what we call the Preparing Digital Health Denmark. So we are meeting at the board and also in the executive leadership. We are meeting every 14th day. But if I should say it in a short way, actually the users shouldn't feel anything, because we have been doing very well. We have a very good portal. We have very, very many good services. So actually they should not feel it. But though I hope that some of the advantages of this going together will be seen by the users very soon. And I look very much forward to having a research or rethinking about this digital front door. How are we going to make it, and what should be used and what should be reused and what should be sent away. Yeah. So we have now a possibility to rethink what the best service is. And it is not, I'm sure, it is not what it was 25 years ago.
Mm-hmm. Earlier you mentioned that you're rebuilding part of the IT structure to modernize it. How are you doing that so you're not going to have a newer legacy in 10 years' time?
No. We're trying to take all the learnings we've had from the first 25 years. And we are building up more modularized in modules. Instead of the old portal, it was much a core of spaghetti. Now it's more modularized, so you can
more smaller parts that are easier to just change, renew. Yeah, you don't have to dig the whole system.
Exactly.
Yeah. I mentioned how are the patients going to feel that, but with the high levels of healthcare digitalizations, what other changes are predicted with the health reform? How is Denmark preparing for the general transformation of healthcare with the move from hospitals to home, enabling more care at home while trying to make sure that you don't leave people behind?
I have not a clear answer for that, because until now it is the purpose of the reform to have more focus on digital and home-based care than the hospital. And in the political arena, and it's fully legal, you have a pendulum. Sometimes we are building more specialized hospitals. We did that 10 or 15 years ago. And sometimes we are going the other way because people feel now they want something near around where they live. Now we are doing that. So we are not closing down the highly specialized hospitals. No way. They will be filled with happy patients. But also in the new structure, the super hospitals, as we call them, there will be fewer beds, 25% fewer beds. So people also have the possibility to stay home. And we have to support them with home care devices that make it possible to stay home.
Absolutely. It's as they say, Rome wasn't built in a day, and digital transformation doesn't happen overnight. Oftentimes we feel like things are moving too slowly, but then when you look 10 years back and what has changed in 10 years, you actually see that a lot has happened. So when it comes to the reform, what are you most excited about? Or what change do you see as most impactful?
I really like the reform because it says you need more digitalization. So it really focuses on the possibility of using the digital services. And also it very much focuses on more equity in health. So that's two half things for me, more digital services and more equal equity in health. So two good things.
Given that Denmark has a long history of healthcare digitalization and patients, I assume, are used to the digital interaction with the healthcare system, how much effort do you need to put into digital health literacy and upskilling of patients if the system is moving towards them more?
A lot. Denmark is like other countries, maybe 20% that not digital enabled. So we really have the problem. It's not the elderly people because they are elderly, because actually those plus 65 years are the rapidly growing user groups for us. Because when they were young, we had home banking 15 years ago. So they are able to use the digital services. It's more about also young people who are not good to read, then they are not good being digital and so on. We have to move on. And also we have to use the services which we have at Sundhed, which is the possibility to give a family member the possibility to look up your data. So if you're 50 years old and you have an 80-year-old parent, you can have the consent that it's okay that you're looking up the data, that you're helping. Maybe your parent lived 200 kilometers away. Now you can help him in a digital way. So that's a very, very important tool that if you think about your own feelings for your dad, for your mom, or for your children, then now you can help them in a digital way.
Mm-hmm. Yeah. Critical shifts that are happening in healthcare. Thank you for the short discussion here in Barcelona. We're definitely going to have more of the discussions in the future, a longer one in a bit of a quieter setting. We had to improvise to just find a spot in the lunch area, and I guess that's going to be our next stop.
Yeah.
Thank you.
Thank you.